Barbara, Secretary Sudders. I'm sorry, I struggled with this story. It is my distinct honor to address all of you and have the opportunity to share my story. This is a place that has been difficult for me to revisit, but I feel necessary so that I can educate others on the devastation that sepsis leaves behind. My experience with sepsis has changed the trajectory of my life. Let me begin by saying sepsis was a word I never heard of until it was taken over my body. I come from a family of 8 brothers and sisters who never heard of sepsis either until they heard that their sister was at death's door because of it. My story began when I was working at Coca-Cola and my position was being transferred to Florida. I chose to go in the hospital for an elective surgery to remove a large cyst in my abdomen that was causing pain. The night following my surgery, I knew something was wrong. I didn't feel right. I was having a lot of pain, and where I'm usually outgoing and chatty, I now became introverted, quiet, and concentrated on what was happening to my body. My family came to visit me and voiced concerns to the nurse that something was wrong with me and that I was not myself. My sister told my nurse I felt warm, I appeared flushed, and it wasn't normal. This is where we began to hear the statement we consistently heard for the next 2 days. This is normal after surgery. Throughout the night, the pain was getting worse. When communicating with my nurse again, I was told this is normal, and this is gas pain, and walking around would help to move the gas. The next day I was supposed to be discharged, but I requested to stay because the pain was becoming intolerable and I just felt something was wrong. At 10 p.m. that night, I called for the nurse, voicing that I can't take this pain any longer. She again assisted me in walking the halls to move the gas around. To this day, I will never forget the moment I was finally heard. It was 5:25 a.m. when I called the nurse yet again. My heart was racing, I was short of breath, and I felt like I could not move because of the tremendous pain that I was in. All of a sudden, there was multiple people in my room doing multiple different things to me. I now had the telltale signs of sepsis: dangerously low blood pressure, heart rate over 180 beats a minute, and the temperature that eventually went up to 104. As alone and afraid as I felt a sense of relief that they will fix whatever is happening to me. Little did I know what I was about to face. I had severe septic shock and I was in for the fight of my life. I spent nearly 2 months in the hospital and had several complications. I found out the hard way that sepsis is something that affects all systems in your body. I was taken to the operating room again, and when they opened me up, they found gross spillage of bowel content in my abdomen. My incision was left open hip to heal from the inside out. I developed fistulas with high output. At that time, I did not know what that meant until I had to drink contrast for a CAT scan, and all of the contrast poured out of the open incision in my abdomen and into my lap. Needless to say, I was a little freaked out by that. I had large fluid collections around my lungs, which caused them both to partially collapse. I had low oxygen levels, and I ended up in respiratory distress. I was transferred to the intensive care unit. There I became confused and was restrained to my bed for pulling out my NG tube. I was that patient, a yeller, offering anybody who would walk by my room $50 to come in and untie me. I was not allowed to eat or drink anything, not even a sip of water, for months. I was fed intravenously. There were many other complications that took place during my hospital course that I could go into, such as pneumonia, severe edema, large abscesses throughout my abdomen, just to name a few. But I also wanted to discuss the long-term effects of sepsis. Yes, I am a sepsis survivor. I am one of the lucky ones because I found a way to compensate for the lingering effects that I was left with. One of my complications is a brain injury that affects my short-term memory. This is a long-term effect of sepsis for me. When I found out I had a brain injury, I did not want to look at myself as someone with a disability, so I chose to look at myself as someone who has a quirky way of processing information. It made it more acceptable to me. It wasn't until I had a boss who made things very difficult that I realized I had no choice but to accept the fact that I did indeed have a disability. I was different. I did not have a support system within a management team. PTSD, yes, I was dealing with that too. The trauma of what I went through has affected me with anything medical that I have to go through now. I do not have trust in putting my life in someone else's hands. It causes severe anxiety attacks when I have to have anything done medically. PTSD is a reality of most sepsis survivors. My recovery was long and continues to be ongoing. There was physical therapy and counseling, but I had an immense family support team around me. I needed each and every one of them. My brother took care of my son for months when I could not. My mother became my caretaker for months, and my father would support all my bills financially as long as he could. I eventually lost my housing and my independence, relying solely on my family to get me through this. I had to go on Social Security disability because I could not emotionally get through the trauma. I made the decision not to be a victim to sepsis and fight it in a different way. Sepsis may have taken my health, my home, my trust, my short-term memory, but it did not take away my voice. Sepsis gave me the passion and drive to advocate and educate all who may encounter it. I went back to school and I became a registered nurse. I wanted to help others who have gone through this, and I wanted to advocate for those who knew nothing about the medical field. I am happy to say, with my quirky brain injury, I was able to graduate with the following honors: Phi Theta Kappa, Psi Beta, Sigma Theta Tau, and Golden Key Honor Society. There are many cognitive and physical challenges that sepsis survivors face. Sepsis does not discriminate, and mortality rate is high when it is not recognized early. I can only ask that there be a focus on education, especially in hospitals and schools. I feel resources for survivors and families are far and few between. I was very fortunate to come across the Sepsis Alliance website when I was searching for some sort of resource to help me or deal with sepsis. They have resources and modules available to educate not only sepsis survivors, but also those in the healthcare field. They have given me the opportunity to attend a trip to Washington, D.C. to speak to the United States Senate about sepsis. They have also made it possible for me to become involved with the Betsy Lambert Center and work with such amazing people. My ultimate goal is to see hospitals have sepsis protocols in place to identify the early onset of sepsis, and also to have resource available to those who survive sepsis. Had someone noticed early what was happening to me, I'm sure my story would be very different, and I would not have to have suffered in the way that I did. Thank you for your time, and thank you for the opportunity to share with you the devastating effects of sepsis and how it impacts survivors for a lifetime.